Pain during intimacy, it's something that's common, but it can also feel deeply personal and, honestly, pretty isolating. So today, we're going to pull back the curtain on this, moving from confusion to clarity. We're going to break down the medical condition known as dyspareunia, using these slides to guide us. For so many people, this is the question that just echoes in their mind. It's a question that's loaded with so much anxiety and self-doubt, that fear that maybe, just maybe, it's all in your head. Let's just be absolutely clear about this. The answer is no. While anxiety can definitely play a part, dyspareunia is a recognized medical condition with real physical causes. What you're experiencing is valid. It's real. All right, so let's actually put a formal name to this. It's so important to understand that this isn't some kind of personal failing. It's a legitimate medical condition that absolutely deserves a proper diagnosis and treatment plan. And that medical term is dyspareunia. And just having a name for it, that can be a huge first step. It validates what you're going through and lets you seek help with confidence. Medically, it's defined as persistent or recurrent pain that's linked to sexual activity. And this pain, it definitely doesn't show up in just one way. It's not a one-size-fits-all thing. For some people, it's this sharp, stinging feeling right at the start. For others, it's more of a deep, aching pain that can even spread. It's so important to know that all these different experiences are normal for this condition. Okay, so now let's get practical. To find the right solution, we first have to get really specific about the pain itself. Classifying it or breaking it down is absolutely the most important first step toward getting treatment that actually works. So the first big question is, where does it hurt? Is it superficial, right there at the entrance, maybe feeling like a burn or a sting? That often points a doctor toward things like hormonal changes, an infection, or certain skin conditions. Or is it deep dyspareunia, which is more of an ache deep inside the pelvis during penetration? That could suggest something different, like issues with pelvic floor muscles. All right, the next piece of the puzzle is, when did it start? If the pain has been there from the very, very beginning, we call that primary dyspareunia. But if it's something that developed later, after a time when intimacy was pain-free, that's called secondary. And actually, this is the more common form, often popping up after big life events, like childbirth or menopause. I know experiencing this can feel so isolating, but I promise you are far from alone. Research shows that about 7.5% of sexually active women in the UK have reported painful intercourse. This is a common health issue. And when we look at the data, it's pretty interesting. We see two main spikes. One is among younger women, from about 16 to 24, where the causes are often things like infections or overactive pelvic floor muscles. Then there's another peak in women aged 55 to 64. And here, a leading cause is something called genitourinary syndrome of menopause, or GSM for short. Okay, so we've defined the problem, we've broken it down. Now, for the most important part, what can you actually do about it? This next section is all about empowerment and understanding the concrete steps you can take to find relief. And the good news is, the path to feeling better can start right now, with things you can do yourself. Simple things like using a high-quality lubricant to reduce friction, taking more time for foreplay to help with natural lubrication and muscle relaxation, and even just trying out different positions that put you in control of the depth and angle. These can all make a huge difference. But what if self-care isn't quite enough? Well, that's when you bring in the experts. There are some really powerful medical and specialist options out there. Depending on what's causing the pain, this could be anything from topical hormones to help restore tissue health, to specialized physiotherapy for your pelvic floor muscles, or even therapy to help break that vicious fear-pain cycle. The key is, these treatments are targeted right at the root cause. Okay. I need to shift gears for a second here and talk about something really important. While most of the time this is something you can manage with your doctor, there are specific symptoms that you should never ignore and that need immediate medical attention. So please, listen up. We're talking about red flags. If you experience any of the things we're about to show you, it's a sign that you need to get medical help urgently. Let's go through these and please take them seriously. Sudden, really severe pain, any heavy or unusual bleeding, a fever, pain that comes along with an abnormal or foul-smelling discharge, or if you find any new lumps or lesions down there. Any one of these means you should make an urgent call to your doctor or gynecologist. Please don't wait. Talking about all of this requires really trusted expert guidance. You might be wondering, where is all this clear, actionable information coming from? Well, this whole explainer is grounded in real clinical expertise, and we want to introduce you to the medical reviewer who makes sure everything we're telling you is top-notch. Everything we've talked about today has been medically reviewed by the wonderful Dr. Farzana Khan. And let me tell you, her background is perfect for this topic. She's an MD with special qualifications in sexual and reproductive health, and her entire clinical practice is focused on vaginal health, sexual function, and the very conditions that can cause dyspareunia. She's so well respected, she even trains other doctors in this field. And this quote from her really says it all, doesn't it? It's not about being told what to do. It's about a partnership. It's about understanding your options, setting realistic goals for what's possible, and making those decisions together with your doctor. It's about being an active participant in your own healthcare. So, after everything we've gone over, it all comes down to this one question. Understanding the terms, knowing the potential causes, and seeing the solutions, that's the first huge step. The next one is taking that knowledge and using it to speak up for yourself. So, are you ready to take that next step and advocate for your intimate health?